Avocados have become a dietary staple among Filipinos. Not only are these bright green fruits delicious, they contain an assortment of vitamins and nutrients that help our bodies function properly. For example, did you know that they can help regulate our blood pressure or they can improve our vision? On the program today, we'll talk more about the health benefits of avocados. I'm Dr. Freddy Gomez and welcome to MedTalk Health Talk on CNN Philippines. In case you need any more of a reason to add avocados to your diet, our guests are here today to tell us about its many health benefits. With us is Ms. Pia Batua Mabuhay. She is the co-founder of NutriCoach Incorporated and the president of Sports Nutrition Association of the Philippines. Also with us is Dr. Maricar Esculto-Can. She's an internist and clinical nutritionist and a consultant from the Makati Medical Center and the St. Luke's Medical Center in Global City. Now, avocados are a good addition to an already nutritious diet. Now, I'll start the conversation with Ms. Pia. Ms. Pia, what are some of the nutrients, some of the vitamins that can be found in avocados?
They have a very unique nutrition profile. And aside sa good source of good fat siya, kilalang-kilala, monounsaturated fatty acids, ang avocado contains lots of fiber. Mayaman din ito sa vitamins and minerals such as B vitamins, vitamin K, potassium, copper, vitamin E, folate, lutein, beta-carotene, and so on, and also vitamin C. So these are actually antioxidants.
Among the avocado's many nutrients is potassium. Now, a single avocado has about 140 milligrams of it. That's even higher than the potassium that you can find in one banana. And this mineral is vital in maintaining normal blood pressure. Now, Dr. Maricar, I'll talk about that. How is potassium related to someone's blood pressure?
Potassium is one of the most important minerals in the body. So it has a lot of role in terms of regulating our fluid balance, the muscle contractions, and the nerve signal. So all of those have a role in the functioning of our heart. Now, potassium is the main electrolyte inside our cell, while sodium, which is another mineral, is the main electrolyte outside of the cell. An appropriate fluid balance in our body is kept by proper amounts of both potassium and sodium, such that if you have too much sodium and low potassium, you will tend to have a higher fluid in your circulatory system. So making your heart exert an extra effort in terms of pumping the blood, and this can result in the elevation of the blood pressure.
But if they are already diagnosed by a doctor to have high blood pressure, what is your advice to them? Can they forgo their maintenance medications and just eat avocado?
Of course, you need to address the health of your diet, but this is still an individualized management. You need to consult with your doctor if ever there is a need to change the dose of your medications depending on the degree of control of your blood pressure.
Ms. Pia, when it comes to the recommended amounts of potassium in a day, how often can they add avocados into their diet to meet that goal?
Yes, avocado, good source of high in fat siya, but monounsaturated fat, which is the good fat that helps lower bad cholesterol or the LDL. So as long as you eat them in moderation, usually the recommendation is 1/3 of an avocado to one small piece is enough. So avocado kasi it gives about 50 to 80 calories per serving. So in moderation, and also dapat mindful tayo sa pagkain.
Is this the same unhealthy fat and cholesterol that is seen in animal meat, animal fat?
This is different from what we see from animal fats. Avocado is rich in monounsaturated fatty acid, especially oleic acid. So ayon sa mga studies, ang avocado, it reduces LDLs but do not lower the HDL, which is the good fat naman. So cholesterol is a soft, waxy substance that can cause clogged, or as we understand, yung mga arteries natin bumabara. So keeping your LDL or the bad cholesterol level low reduces your risk for heart diseases and stroke.
What is this ratio all about, and how does the LDL and HDL relate to each other?
LDL is branded as the bad cholesterol because it is the type of cholesterol that becomes deposited in the blood vessels. Okay, so we do not want our blood vessels to become hardened by this cholesterol deposits because it will result to an elevation of your blood pressure. It will exert an effort in terms of your heart distributing the blood to the body. Now, HDL is branded, or the high density lipoprotein is branded as the good cholesterol because usually it is the one that collects the cholesterol from the periphery and brings it back to the liver. So it achieves the opposite process of deposition. You want to have an elevated level of your HDL compared to the LDL.
Now, a healthy gut contains healthy bacteria as well as immune cells that can guard against infectious bacteria, viruses, as well as fungi. Now, one of the most effective ways to improve its health is through getting enough fiber. Dr. Maricar, tell us how this nutrient improves gut health. How important is fiber in a person's gut?
Fiber can come in two forms. It can be insoluble fiber and the soluble fiber. Insoluble fiber plays an important role in cleaning our bowels, preventing constipation, and helping to keep our bowel movement regular, while soluble fiber helps in terms of lowering the blood cholesterol and sugar levels.
Dr. Maricar, let's start with someone's blood sugar. Avocados having a low glycemic index, how does this help regulate someone's blood sugar? How does this help with trying to manage a diabetic, for that matter?
One of the benefits of fat in the diet is actually to slow down the absorption of sugars from the diet. Thereby, when that happens, it results to a slow sugar spike in the blood. And for patients with diabetes, you don't want sudden blood sugar spikes. Basically, glycemic index is the capacity of a certain food item to cause a spike in the blood sugar. And avocado is among the fruits that are classified to have a low glycemic index. If ever you would make recommendations or you will make meal plans for your patient, it is ideal to include this also in their daily requirements.
When we return, more of the avocado's other health benefits. We're your partner in healthcare. You're watching Med Talk Health Talk. I'm Dr. Freddy Gomez, and welcome back to Med Talk Health Talk. Healthy food promotes healing. As we discussed earlier, those high in potassium can help lower blood pressure and keep our hearts healthy, while those high in fiber can improve our gut health. Now let's talk about anti-inflammatory foods, because these can help reduce inflammation, improve immune function, and lower your risk of certain illnesses. Now, while inflammation is a normal response in our body up to a certain point, it's how your immune system reacts to irritation, injury, or even infection. If it lasts too long, it can be extremely harmful. Avocados contain some anti-inflammatory properties that may help relieve some of this. Let's talk about the role of microinflammations have on a person's body, in a person's gut, for that matter.
Inflammation is not good. Okay, you do not want to have inflammation in your body because it can have a bad effect in your cells. Okay, so whenever we design diets, we would want to promote something that does not promote inflammation. So what are the food items that usually promote inflammation? Processed foods, or those that are super high in simple sugars. Inflammation is contributory to the development of various diseases in the colon, such as the development of cancer or other ulcerative conditions that result from inflammation. Now, if you are speaking about the blood vessels, the mechanism for atherosclerosis, or the hardening of your blood vessel walls, is also resultant from inflammation.
Avocados are also packed with vitamin C as well as A and E, which have significant antioxidant levels. Ms. Fia, in terms of how many avocados do we need to take in a day, what's your tip for our viewers? How many avocados is good in order to maximize these health benefits of this fruit?
The avocado, as being part of the diet, magugulat tayo, ang recommendation is about 1/3 only of an avocado, and it actually will provide enough vitamins and nutrients like fiber on a daily dietary requirement natin, it's about 20 to 30 grams of fiber per day. So yung overall intake pa rin yung titignan natin. So we should still get these nutrients, these vitamins, these minerals from other food sources.
Let's talk about antioxidants. Avocados are high antioxidants. When it comes to antioxidants, Dr. Maricar, what is a realistic way to look at how antioxidants work?
It prevents oxidation. And medically speaking, as we know, most of the, if not all of the chronic diseases that are known to us results from oxidative injury or oxidative stress. Okay, so how you will relate that to inflammation naman. Inflammation is triggered by this oxidative stress. So when oxidation is prevented, inflammation is also prevented.
How is vision health improved with avocado? What is it about the avocado? What does it contain that could improve someone's eyesight?
Okay, so lutein is a type of pigment in food that have an antioxidant and anti-inflammatory property. So lutein is usually concentrated in a region of the eyes called the retina, where it acts as a scavenger for harmful compounds. Again, products of oxidative stress. So usually they may damage the eyes if they are not managed accordingly. So if you have a good source of lutein in your diet, you have a lot of scavengers that can prevent injury happening in the area of the eye.
Now, Dr. Maricar, another health benefit of avocado is with expectant mothers during pregnancy and in breastfeeding. How does avocado help in this manner naman?
Avocado is also a rich source of folate, which is an important vitamin needed in pregnancy to support the developing baby's brain development. Okay, so actually half of an avocado can already meet 14% of a pregnant woman's requirement for folate daily.
Ms. Fia, when it comes to folate, how important is this not just for pregnant women, but for women in general? Would you recommend that taking a multivitamin would be able to accomplish this goal of getting all these requirements, or getting it from the diet is more recommended?
Tinitignan kasi natin palagi is whole food first tayo muna. So food first muna tayo. So kung tingin naman natin na nakukuha natin ng sapat yung nutrisyon na kailangan natin ng pangangatawan natin, we actually don't need multivitamins unless recommended by your doctor. So always, it is best to consult with your doctor.
As with most things, too much avocado can have some adverse effects. We'll discuss some of these when we return. Your health is our mission here on MedTalk Health Talk. We'll be right back. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk. Now, many people would be surprised to know that among the many benefits of avocados is that it is great for our skin. Ms. Fia, paano naman nagiging maganda ang pagkain ng avocado para sa healthy skin?
Dahil nga ito ay rich in variety of essential nutrients that may prevent the negative effects naman of aging. So vitamin K, C, E, A, B vitamins, these are antioxidants. And antioxidants, as we all know, may maganda siyang naitutulot sa ating mga balat.
It's also said that the avocado is a recommended fruit for those who are diagnosed with psoriasis. Dr. Maricar, could you tell us more about this and the link of the benefits of the avocado fruit with psoriasis?
Psoriasis is an example of an inflammatory autoimmune disease. So clinically, if you see patients in your clinic, patients with psoriasis presents with red, itchy, scaly patches on the skin, sometimes particularly on the elbows, on the knees, and in the scalp. So since the mechanism of the disease is inflammatory, patients will benefit from including in their diet foods that have a known anti-inflammatory effect, and this includes avocados.
As we all know, too much of anything is a bad thing, and that also goes with avocados. What are some of the health risks that can happen if people eat too much of avocados?
It also provides calories, and excessive calorie intake may trigger or may also promote weight gain. A serving of avocado provides about 50 to 80 calories. So that's just 1/3 of an avocado. So if you're aiming to maintain, again, your weight, it's very wise to measure the portion or be mindful of the portion of your avocado. So yun nga, para hindi tayo mag-overload on it. So we have to balance everything from our nutrient intake, from carbs, protein, and fat. So we have to be mindful.
Now, Dr. Maricar, let's talk about those who have an allergy to this fruit. What are some of the symptoms that they may feel? Because there are certain fruits, especially those who have some allergies to bananas, to kiwis. They may also have this allergy with avocados. What are some of the signs and symptoms that may point towards an allergy for this fruit?
Speaking about allergies, it is not common to encounter patients who have allergies to avocado. But as we know, usually allergy can manifest in various forms. It can be cutaneous, which can present as itchiness in the skin or the appearance of wheals and rashes. So allergy can also manifest as gastrointestinal symptoms. So patients may have feelings of bloatedness or diarrhea.
What are some fruits that may have the same amount of nutrients as an avocado, but maybe hindi sila allergic naman doon? What are the other options aside from avocados?
Aside from avocados, there are a lot of fruits that we can still take in with good source of fat, but hindi sila same with avocado. We have like kiwi, we also have yung ating mga chico, bananas. So they also have very rich in antioxidant potassium that is also good for our heart. And it can be, kung gagamitin naman natin sa cooking, it can substitute avocado when it comes to its creaminess and in kanyang texture.
Now, before we go, any final tips or advice for our viewers on how to maintain a healthy overall self?
Let us remember that there are general recommendations for a healthy diet, but if you would want something that is more tailor-fit based on your needs, okay, because some people can have special considerations, special requirements. So it's still best to consult your registered nutritionist, dietitian, and physician for you to be able to have a well-designed nutrition and diet plan.
And Ms. Fia, any final advice?
It should be, yung overall nutrition or diet, it should be individualized. So it's best to consult with a medical nutritionist, dietitian, and also a physician. Kung meron tayong mga medical ailments, we have to address them with a proper supervision with this health medical professions.
Thank you very much, Dr. Maricar Escotar-Khan and Ms. Fia Batua Mambuay for being with us today. We definitely learned a lot more about the benefits, the health benefits of this tiny fruit, the avocado. Thank you everyone for watching MedTalk Health Talk. I'm Dr. Freddy Gomez and we'll see you again next time.